First question, what's your opinion about this? There's no simple ankle sprain. In your mind, true or false?
Probably true. Probably true.
And why so?
Probably true. So, I mean, when you think about it, there's, 20,000 ankle sprains a day in the United States. And so, you know, somewhere between 15 and 20% of those go on to what's called chronic ankle instability, and you've taken care of those patients. So, I mean, yeah, there's some people, hey, I rolled my ankle, did my rehab 3 weeks later, I'm back at it. But there's always, there can be some kind of residual, even if they don't then have instability, you can, the ligaments on the lateral or the outside part of your ankle, when you roll your ankle inward, are actually partially intra-articular. And that, just for the listeners, that means it's part inside the joint and part outside the joint. And those ligaments, even from a, quote unquote simple ankle sprain, can then scar in. And I'm sure you've taken care of patients who
Mhm.
you refer to the ortho doc because you're like, hey, I don't know why this, they should be better. They're not
Yeah.
unstable. They healed their ligaments, but why do they still have some pain?
Yeah. And some of those peroneal muscles that play an important role in, the ankle dynamic stabilizers. We've also, well, at least in the research, we've also seen that ankle everter fatigue can lead to a potential for ankle sprains, especially in that lateral half, of people that have had a history of ankle sprains.
Yeah.
From your experience, do you think that these peroneals should warrant more attention when, medical professionals are trying to rehab an ankle sprain?
Oh, absolutely. You bring up a great point. And, there was a study done many years ago looking at, people with, or soccer, particularly soccer players, and, they put monitors on them, and the, there's a higher incidence of, with players who have some type of instability, there's a higher incidence of sprains in the second half because of peroneal muscle fatigue, because it's
Right.
the dynamic stabilizer, right? And so, and it's interesting, I kind of teach my residents and fellows this, is when you see somebody, comes into the office and they have chronic ankle instability, and you've seen those patients too, they're like, okay, I sprained my ankle like 7 times, and now if I like
Mhm.
get out of bed and step on a pencil, I'm going down. If you talk to them, you say, hey, if you've been walking or you had a big day, does the outside of your leg ache? And they're like, yeah, it does. Because,
Uh-huh.
and you brought up the great point, because the perineals are such an important part of it. And if you then fix their ligaments and do the surgery to get the ankle stable again, that goes away. But part of my post-op protocol, and I rely heavily on my my therapy team,
Mhm.
make sure they work on that, because I think for a lot of athletes, and particularly younger athletes, when you're getting ready for a season, you're hitting the weights, you're doing your squats and all that kind of stuff. But who then sits there and does like
And that's a
version
little
after
movement, yeah.
exactly.